Welcome, everyone. Welcome to the Maine Medical Association's 2010 Gubernatorial Candidates Public Health Forum. I am Dr. Joe Linder, president of our association, and will serve as the moderator for this event. The MMA Public Health Forum has become a Sunday morning tradition at our annual session. This year, we focused on life transitions. In recognition of Maine's significant upcoming transition in leadership, we are thrilled that all 5 gubernatorial candidates agreed to participate in today's forum. Thank you for coming. Thank you all for coming. Let me start by describing our next 90 minutes together, and I will briefly describe why this topic is so important and the ground rules, followed by an introduction of each candidate in alphabetical order. They will then speak to one of 6 questions in the order determined earlier by random drawing. That's why they're not standing up here in alphabetical order. This illustration, borrowed from a public health colleague, provides a sense of the complexity of the public health system. A healthy state depends upon the collaboration of many individuals, organizations, and businesses, excuse me, in public-private partnerships, including members of our Maine Medical Association. And you can see that doctors are listed there, all kinds of businesses, individuals, organizations in this complex web called the public health system. Elected officials and their appointees are at the center of this public health system network. The ground rules. This is not a debate. There will be 6 rounds with 2 minutes allotted to each candidate to answer one of 6 questions. The questions were sent to all candidates and posted at our website. And I believe there were questions out front on these blue sheets for you in the audience. Any rebuttal will use a portion of that 2-minute time period. Mariah Gleaton is our timekeeper. At the end of the 6th round, each candidate may give brief closing remarks. Audience members, please do not applaud or make any verbal comments. And due to time constraints, questions will not be taken from the audience. You are welcome to stay for any informal interaction following the conclusion of this forum. However, I know that many of these candidates have other pressing campaign places to be, so we are grateful for whatever time they can stay. So the introductions. Elliot Cutler was born and raised in Bangor, Maine. He earned his undergraduate degree from Harvard College and law degree from Georgetown Law School. His political career started as legislative assistant to Senator Edmund Muskie, working on the Clean Water and Clean Air Acts. He is a founding partner of an environmental law firm that merged with an international firm in 2000. Elliot Cutler is an independent candidate for governor. Paul LePage grew up in central Maine. He earned his undergraduate degree from Husson College in Bangor and an MBA from the University of Maine. He currently serves as the mayor of Waterville. He is the general manager of Martin's, serving in that position since 1996. Mayor LePage is the Republican Party candidate for governor. Libby Mitchell was born in South Carolina and lives in Vassalboro, Maine. She did her undergraduate studies at Furman University, the University of North Carolina at Chapel Hill, and earned her law degree from the University of Maine. She is a former Speaker of the Maine House of Representatives and is currently President of the Senate. Senator Mitchell is a Democratic Party candidate for governor. Sean Moody grew up in Gorham, Maine, where he currently resides with his family. He founded an auto body repair business, now Moody's Collision Centers, during his senior year in high school. His company converted to an employee stock ownership program in 2003, giving Moody's employees a 34% stake in the company. Sean Moody is an independent candidate for governor. Kevin Scott was born and raised in Mexico, Maine. He earned his undergraduate degree from George Mason University in government and politics. He founded Recruiting Resources International for engineering employment services. Kevin lives in Andover, Maine, and has participated on town volunteer committees currently serving as president of the Andover Water District Board of Trustees. Kevin Scott is an independent candidate for governor. And there they are. So the questions. Question number one, we'll start with Kevin Scott. Recently, there has been a significant and alarming increase in the percentage of smokers in Maine's underage population, with the understanding that youth are especially susceptible to price increases. What is your position on raising the excise tax on cigarettes and other tobacco products in order to discourage their use?
You know, as an independent candidate, I bring a lot to this race, and one of those things I don't bring is a desire to raise more revenues through taxation. But I can assure you that on this issue, I am very supportive of any initiative that will increase cost of tobacco products. There are a lot of folks out there, adults, who enjoy tobacco products responsibly. We all know the repercussions. So I don't think I'm going to give you an education on that one. I would support an initiative that seeks to increase that cost. I would also seek to stipulate that any excise tax or increased revenue from those consumers of tobacco product go directly into the fund for a healthy Maine.
Thank you.
Well, I start out by saying that smoking is a very powerful and complex addiction. My mom raised the three of us, single mom, cutting hair, very strong-willed individual, smoked from like 30 years on. Probably raising the three of us didn't help the stress around the household there, but the reality of it is, once you start, it's just absolutely, it's unbelievable to quit. I never started, and that's obviously the keynote right there, is just don't allow our young people to start. I would favor a slight increase, although I'm not convinced that there's a correlation, a significant correlation between keep going up on the taxes. But what I would definitely insist is that any dollars that were raised from that tax that were used to fund enforcement. You know, you hear it a lot about underage drinking things, and we need to do a better job on enforcing the sale of tobacco products to underage teens. I mean, it's a real problem, and we need to address it. So I would be in favor of raising it if the sole use of that was to promote, just raise the awareness at the early ages. You know, and we got to go down below middle school now. You know, this is a fast-paced society with the internet and everything else, and people, unfortunately, assume these bad habits very early in life. So we can't be naive. Early education, understanding, and more enforcement if there was to be an increase. Thank you.
Thank you.
Thank you very much. In this very difficult economic environment, even though there is a correlation between the cost of tobacco and youth smoking, I would not be in favor of raising the tobacco tax at this point. However, I would be in favor of finding other avenues of dealing with the youth smoking epidemic. It's alarming that the rate is rising. We do have a fund, a tobacco-free partnership. We need to do more education within the schools. We need to use our Healthy Maine Coalition partners to educate students, and we need to make sure that there's an emphasis in the schools. And for those young people who do begin to smoke, we need to help with cessation programs before they're addicted. The fact that Maine has so many places, that we have changed the culture of Maine. There's so many smoke-free places because we appreciate not only the impact on the individual who is smoking, but on the people who are around. It is offensive. It affects public health for everybody. So at this point, absolutely not raising the tobacco tax. We need to explore all the other means to stop the increase in smoking for young people in Maine.
Well, obviously, I would not support increasing taxes on tobacco products. The one thing that we have to remember is those who are addicted, and having come from the welfare environment, I know what happens when you raise the taxes on tobacco products. What happens is they get their cigarettes one way or another, and who suffers but the kids? Because they'll give up dietary, good dietary programs to get their cigarettes. And believe me, I see it. I've seen it. So the best thing is educate, don't legislate. We need to do it through education, through our schools, and try to work at getting our families back together. And quite frankly, the quickest and best way to solve this problem, let's make Maine prosperous so we have the money to deal with it.
I've battled addictions all my life. I'm overweight. I used to smoke. Both my parents, one of whom, Lawrence Cutler, was the chief of medical services at the Eastern Maine General Hospital. Both my parents died of smoking-related diseases. And so more than anyone, probably, I appreciate the fact that 60% of every dollar we spend on health care in the state of Maine today goes for the care of chronic preventable disease. And I know how hard it is to quit. I quit in 1988, and I haven't touched any tobacco products since. This organization, the MMA, has battled hard on cessation programs, and the fact that Maine, until the last year, had such a strong record was, I think, due to your leadership, and I commend you for that. I don't think we can raise broad-based taxes until we have control over spending in the state of Maine, and we don't today. And raising taxes, though, on cigarettes, which is not a broad-based tax, clearly is an effective strategy, and I think it's one we need to think about. But before we decide to raise taxes on cigarettes, which is highly regressive, I think we need to do the very best job we can in two other important respects. First of all, we need to rely on primary care physicians and the relationships between physicians and patients in a medical home. And secondly, we need to rely on schools as school-based health centers and as community centers where kids are taught, even more than they're taught today, the dangers of smoking. If these programs don't work and we continue to see a rise in teenage smoking, then I think we need to look hard at taxes.